If you have a sore shoulder, if you have trouble raising your arms, if daily chores are painful, you might consider chatting with tonight's Ask the Doctor guest. Dr. Tom Christensen is an orthopedic surgeon with Reno Orthopedic Clinic specializing in upper extremities. Thank you for being here.
Thank you for having me.
You know, at what point does someone say, okay, I'm exhausted of this pain, I need to come see you?
Well, I see patients with shoulder, elbow, hand problems of any age, so there's not really an age cutoff. Typically, people start coming in when their quality of life is impaired. So they're having trouble reaching for something off a shelf, or younger folks are having trouble doing sports, or even sometimes older folks are having trouble getting dressed, and they'll come see me.
Okay. Now, you do the traditional shoulder replacement surgery, but let's talk about the reverse.
Sure.
What is the difference?
Well, the original total shoulder arthroplasty, they started coming around in the United States in about 1950s and 60s. These original implants required the rotator cuff tendon and muscle groups around the shoulder to be intact.
Okay.
Nowadays, we're seeing a lot of older folks more active with rotator cuff tears in addition to arthritis. So in the 1970s and 80s, we learned that the standard total shoulders fail if you have a poor rotator cuff. So the newer implant was invented in Europe. In about 2004, it came over to the United States, and it's been our solution for patients with shoulder problems, arthritis, and a rotator cuff tear.
And it basically moves the center of rotation closer in towards the body.
Exactly. It moves
Okay.
the center of rotation towards the midline and gives the deltoid, the outside muscle, a better mechanical advantage to move the arm.
And really quickly, in 10 seconds, what's recovery like?
Most folks are in a sling for about 2 weeks, just resting their arm. Then they come see me and get their stitches taken out. And then they do physical therapy for about a month. And by 6 weeks, most folks are feeling better than they were before the operation.
Fantastic.
Yeah.
All right, we know there are a lot of questions out there. If you have a question, Dr. Christensen will be here until 6 tonight. Call 858-2222. Thanks again.
Thank you.